Hello, welcome to Health Talk. I'm Dr. Manny. Despite the fact that prostate cancer is one of the leading causes of death among American men, screening are far from perfect. Because of high PSA levels in their blood, many men needlessly undergo biopsies. Dr. Harry Fish is a board-certified urologist. He says that new testing can give much more accurate information so men can avoid the invasive procedure. Dr. Fish, Harry, welcome. Indeed, you are one of the most preeminent urologists in the nation. So let's start with the problem. What is the problem with the current screening for prostate cancer?
Well, even before we answer that, 1 out of 7 men, Manny, has prostate cancer. Will get prostate cancer in their lifetime. 1 out of 7, that's an enormous amount. So the issue is, no man should really die of prostate cancer. So we have to have early detection. And the issues are, how do you detect, when do you detect, and are the tests that we have appropriate, and do they lead to unnecessary procedures? And that's where we are today. Right. It's a problem.
PSA, the biochemical marker that is drawn on blood, so men know what it is again, is that a useful tool?
It is a useful tool in conjunction with other aspects. For example, screening is very easy, and men should be screened in their 40s and 50s. But screening is very easy with a digital rectal exam, a prostate exam. As you just said, the controversy exists with the PSA test. And what is the controversy? Well, it's not a great test. If you get a PSA level and it's low, okay, chances are you're not going to have prostate cancer. But that's not where the problem is. The problem is when you have a high level, then many men get unnecessary poking and prodding, and many men get biopsies that they don't need. In fact, if you have an elevated PSA over 4, let's say, and you get biopsied, 3 out of 4 men will not have aggressive cancer. Well, if you have a test where 3 out of 4 men are getting biopsies just because of a test that indicates that that's not a very good test. Right. What we really need is a more sophisticated test.
So do we have one?
I think we do have one, and we're leading towards that way. So, one of the new tests, it's a more sophisticated PSA test. Right. It's called the 4K score test. Mm-hmm. And what it is, it's a blood test in association with some clinical parameters, such as, the results of a digital rectal exam and whether you had a biopsy in the past, accurately predicts the risk of a man having aggressive cancer. And when I mean aggressive cancer, cancer that's going to kill you.
Right. This test that you mentioned, is this something that is being studied, or is this now commercially available for doctors and patients to use?
It is commercially available right now, but it's been studied over many years at Memorial Sloan Kettering Cancer Center, and the test has been brought out to the public by OPKO Health, which is a simple blood test in conjunction with a physical examination and a history.
Right. So you need the physical exam, which is, again, one of those things that men don't necessarily jump the gun to get. I don't know why. Well, I can understand why. But so do you think that this new test is going to replace the PSA as the initial screening tool, or should be in conjunction with?
It's in conjunction with. Right now, a simple PSA test may be in order, but you, again, have to ask your doctor whether you need it. In my practice, men do get it, but that's because we go over the risks and the benefits of getting that test. As I said, if you have an elevated PSA, it could lead to a lot of unnecessary poking and prodding. But so once you get that, if the PSA is elevated, then you go to these more sophisticated tests. And the reason is because this 4K score test can determine which men won't need a biopsy. As I said before, 3 out of 4 men that get a biopsy don't have cancer. Well, we don't want that to happen.
All right, so walk me through the sequence. Let's say it's me, 59 years old, I'm overweight, a dash of diabetes, otherwise I'm okay. I get my PSA done, it comes back 5.
Right.
Again, elevated more or less above 4. Right. You're my doctor, you would say, okay, Manny, let me do a rectal exam, let me examine your prostate. You feel that it's not inflamed, there's no nodularity in the prostate. Right. Then you also draw this new blood test.
Absolutely. And that blood test is so I could tell you whether you need a biopsy or not.
Now, if that blood test, is there specific levels, or is it
yes,
just
there are cutoffs.
There are cutoffs. So you say, look, it's not elevated, I think that you're going to be fine. When do we repeat that again?
Again, it depends on the PSA, because a lot of times it's not so much the number. Like you said, if you had a PSA of 5, but it's really the growth over time, or the increase in PSA over time. Because if it's getting, you're doubling every year or every 2 years, well, that's a risky factor. And then we'd repeat the 4K score.
All right,
test.
so what should men ask their doctor about prostate screening?
Well, they shouldn't even ask the doctor. They should be.
But let's assume the doctor is sleeping at the wheel.
Yes, they say, I want to get prostate screened.
At what age should we start?
In my practice, and in most practices, between the 40s and 50s. Now, here it is. If you happen to have a family member that died of prostate cancer earlier, and if you're African American, you tend to get a more aggressive form of prostate cancer earlier. Exactly.
Okay. I'm in my 70s. Should I still get my prostate checked?
You should get your by digital rectal exam.
No more blood tests?
Not necessarily. You have to discuss that. It's on an individual basis.
Okay, so but the older men get, don't worry about so much about prostate cancer.
But Manny, there's one thing. There's a group of men in this country who've had prostate biopsies, shows no cancer. The urologist keeps on getting more and more and more biopsies. Before you get that next biopsy, get the 4K score test.
And get a second opinion.
That's right.
With Dr. Fish.
That's right.
All right, thank you so much. Where can people get more information about your practice and your knowledge, but also on this new test?
Well, you can always go to harryfish.com, but for this specific test, 4kscore.com.
All right. Well, thank you so much. Good to see you. And if you have any health questions, tweet me at Dr. Manny on Fox. Until next time, I'm Dr. Manny.